morning. So my name is Mercy Olorunfemi. I am the project manager, business support, and I work with Global Alliance for Improved Nutrition, GAIN. I know they once introduced me, I think they introduced me earlier on a project called Advancing Nutrition. That's not it. I actually work under a project called Strengthening Nutrition in Priority Staples. It's a project designed to support access and improve access and increase the consumption of safer, nutritious food at the bottom of the pyramid in Nigeria. And we work across 4 states. So work in states like Kaduna, Oyo, Nasarawa, and Benue State, supporting nutrient-enriched crops and the value chain such as vitamin A cassava, vitamin A maize, and orange flesh sweet potato. So I'm very excited to be here. I'm very excited to lead the conversation today, but I'm not the only one here. I'm actually sitting on behalf of the Scaling Up Nutrition Business Network, SBN. How many of us are part of the network? Okay, so I'm hoping that by the end of this session, we'll have more women and more men. I can see we have men in the room that are part of SBN Network. SBN Network is a network designed to support nutrition-focused businesses, to support their capacity, to ensure that they are supporting value-chain actors, processors, people that are actually producing the food that we consume and making them more safe for us, for our children, and for our community. All right. Now to introduce our panelists, like I said, I'm not the only one. So I have amazing ladies that are going to be taking this conversation forward. I have here the Director, Head of Nutrition Division, Federal Ministry of Health, Mrs. Bako Ayegusi. Please, a round of applause for her. Please clap as she comes forward. Mom, you can sit anywhere. We also have Mrs. Kemi Jeje, Chief Executive Officer, Whole Eats Africa. Please, a round of applause for her. We have Dr. Tominsin Olatunji, founder of Mamalak Foods Nigeria Limited. Welcome, Ma. And we have Sheung Shangoleye, CEO and Mom-in-Chief, I like that title, Baby Grubs Nigeria. Please, a round of applause for her. I will steal that when I finally decide to join you. And then we have Toyin Onibanjo, Chief Executive Officer, August Secrets Nigeria. Please, a round of applause for my women. All right, so before we head into the conversation proper, I know you've heard some really interesting names. I think it's important that we know what they do at their different organizations so that we can get, a holistic understanding of where they are coming from when they start to speak. So we'll start with my right, and we'll start with you, Ma. Please introduce yourself.
Thank you very much once again. My name is Dr. Oluwatomisin Olatunji, and I'm the founder of Mamalak Foods Nigeria Limited. At Mamalak Foods, we fight malnutrition from birth by producing using nutrient-dense ingredients to produce lactation supplements to help boost the quality and quantity of breast milk in nursing moms. And we also have other products for the entire family.
Hello, everyone. Good morning. My name is Sheung Shangole, the Mom-in-Chief at Baby Grubs. Baby Grubs is a winning solutions company based in Lagos, Nigeria. We cater for children 6 months to 5 years. All our foods are made from locally sourced grains, fruits, and vegetables. We sell in Lagos, Nigeria. We sell in Ghana, UK, and some parts of the world. And what we do especially is that we make foods for children from African superfoods, and they are especially they target the prevalent malnutrition deficiencies of the Nigerian child. So we have foods that are helping children to increase their iron levels, protein, energy, malnutrition, things that solve zinc deficiencies, amongst others. Thank you.
Thank you for that. Please, a round of applause for her as well. Toyin.
Thank you. Good morning, everyone. My name is Toyin Onibanjo, and I'm the founder and Chief Executive Officer at August Secret Limited. At August Secret, we raise healthier children using homegrown food solutions. So think of all your lovely superfoods that you have. We make them into amazing cereals and snacks for young children, all those children who don't like to eat. We are the ones who get them to eat. Well, thank you.
Good morning, distinguished ladies and gentlemen. I am Ladidi Kulwa-Bakwa-Yegbusi, MNI, the Director, Nutrition Division of the Federal Ministry of Health and Social Welfare. The division is in charge of all policies that are developed regarding nutrition issues within the health sector. Everybody is sitting on this panel. My division ensure that they do the right thing in line with laid down standards as provided by the government. And I also ensure that it is not just at the national level, also at the state, the local government, and the community. We ensure that the nutritional status of everyone is kept intact. Thank you.
Good morning, everyone. My name is Kemi Jeje. I'm the founder and the team lead for All Eat Africa. All Eat Africa is a wellness food formulation business. And simply say we believe that food should be medicine. And at our core, amongst our core products, we have a range of products that takes care of children, producing food in the same way as we do for adults, but in this case as children, and ensuring that that food for them is medicine. Whether they're dealing with malnutrition or not, whether there is eating hunger or not, whatever, and at whatever stage, as long as they are 6 months old and above, we cater to them and ensure that every time they eat food, it's not just empty, it's actually medicine that they're taking in. And it is fun and affordable as well. That's what we do.
Thank you. Thank you for that brilliant introduction, everyone. I think that was very insightful. I'm happy that you have started introducing what you do under the ministry, Mrs. Bako, because my first question will go right to you. As the head of nutrition at the Federal Ministry of Health, and you're also the Sun Movement Coordinator. Wonderful. Could you share your insights on current nutrition policy landscape and how it supports women-led initiatives in improving child nutrition in Nigeria?
Thank you very much. Okay, thank you, Messi. Nutrition contributes tremendously to the public health issues. And I'm sure we're all aware that Nigeria is currently facing triple burden of malnutrition, in the sense that we have quite high number of persons that are underweight, overweight, and also that are suffering from micronutrient deficiency. So the Nutrition Division that coordinates all policy formulation, implementation, monitoring, supervision within the health sector at all levels, does this using laid down rules. We draw our policies from the National Food and Nutrition Policy. The National Policy on Food and Nutrition was developed in 2016 using multi-sectorial approach. Then thereafter, we now developed the multi-sectorial plan of action for food and nutrition, also in 2016. And we also have the National Strategic Health Development Plan that involves issues around nutrition within the country. So now, responding to the role of the health sector as laid down in the National Policy on Food and Nutrition, we developed the Health Sector National Strategic Plan of Action for Nutrition. And this plan has 8 strategic objective that the plan is promoting, implementing towards reducing the triple burden of malnutrition in the country. The 8th objective include the maternal, infant, and young child nutrition, which focuses on women. We also focus on men, but we pay priority to women. We have the nutrition information system. We have the micronutrients deficiency and control. We have the school age, adolescents, and elderly nutrition. We have the integrated management of IQs, malnourished children. We have nutrition in emergencies. So now, all these strategic objectives are supported by policies. We have the national guideline on micronutrient deficiency that has about 5 strategies that we're promoting to enhance and to reduce micronutrient deficiency in the country. We have the biofortification, we have the strategy, we have the fortification, voluntary fortification, and the mandatory fortification of food vehicles. I'm sure we are all aware of the iodized salts that everybody's, in fact, the last time we had a survey, we found out that over 90% of persons now consume iodized salts. We have the sugar that we are fortified with vitamin A. We have the granite oil. And then recently, we have also worked on a fortification of rice. I think about 3 weeks ago, we launched the voluntary fortification of rice through Kebbi State, GAIN-supported Kebbi State. So also in terms of maternal, infant, and young child feeding, we have a policy, we have a strategy, we have guideline, and we also have training package, because we realize that one of the issues is the food are there, but the women, the community, do not have adequate knowledge on how to prepare this food. So we have the training package that we are using to train service providers at this health facility, the community level. And interestingly, the National Council on Health, which is the highest policy-making body in the health sector, met about 2 weeks ago. And a resolution was approved that the mycin training package should be institutionalized in the states and local government. So that is one of the new policy strategies that we are implementing. Thank you.
Thank you for that robust overview. It's really interesting to see the level of work that's going on, and also to see the work that's been done with organizations such as GAIN as well. So we're going to our next question, which is addressed at Mrs. Kemi. As the Chief Executive Officer of Whole Eats Africa, you have been a trailblazer in complementary feeding value chain. What role does partnership play in your success, which includes improving child nutrition, emphasis on public-private partnership, as well as B2B as well?
Thank you very much, Mercy, for that question. Honestly, I could write a book on that question. Because very early, I came into the industry, the industry a bit advanced. And like I was saying to my colleague earlier, I'm quite a newbie in this industry. And you know how it is in school. When you don't feel like you're the best, you're one of the most intelligent people. You know those intelligent people who like to work in silos. You just cover your book and don't look at my book. But when you know that you're not that good, you're like, let's do it together. Let's do it together, because you know you stand a better chance. So that was an approach we needed to take. Early last year, having ventured into the retail space with our complementary feeding solution, and we realized that it was quite challenging. Then we pulled back from the standard mindset of a business of thinking, okay, I have to produce this food, get it to the market, get money back from it, and that's standard. So we thought, okay, if we look at it in terms of value for value, is there anybody that we can give value with this product? And we realized that yes, government has objectives tied to this product, and then we engage government. If if we're able to, with this product, solve your challenges with malnutrition, what can you do for us? And like she just said, government is an enabler. So we went to government and we said, can you enable us? And then we went to the communities and we said, can we solve this problem with you? So we realized that once we shift from, okay, I want to sell my product and make money from it, and we come to value for value, we have a much broader, stakeholder community that we can work with. We create a bigger pie, essentially. So we go to government, and we've piloted this in Lagos, and it really did work. We go to government as an enabler, and we say, enable us. We go to private organizations that have goals that are aligned with our own goals, and we say, we can give you this value if you give us back this value. So essentially, we create a win-win. We create a bigger pie, and then a win-win for everybody that is interested in that pie. That's what we were able to do in Lagos, and it was very successful.
Thank you for that response. That's interesting. Value for value. So I've heard in different variations of that, but I've not heard value for value before. That's something I'm definitely going to take on. Thank you so much for that. Dr. Tomlinson, as the founder of Mamalak Foods Nigeria, you've made significant contributions to sustainable nutrition. Could you highlight how gender inequality, has impacted your business and some strategies that you've used to overcome this and resolve this?
Thank you very much, Mercy. So, one way, because like I said earlier, we deal with malnutrition from birth. So we focus more from pregnancy to the early days. Because we realize Nigeria has a very appalling statistics rate on breastfeeding. More than 70% of children born are not being breastfed. And this is a very serious issue because if they are not being breastfed, it means infant mortality gets high. You have more rates of women who should be working, being in hospitals. The statistics just goes very, very terrible. So we focus more on that. So one of the ways, we also discovered, when you tell, unfortunately, we have this, should I call it a kind of interest more in formula than breastfeeding. So you get people are quick to want to recommend formula than breastfeeding, unfortunately. People also don't realize that breastfeeding is actually work. Breastfeeding, there's this, women are being brought, you are pregnant, and automatically you just believe breastfeeding just comes along. But unfortunately, because of the society we live in now, it doesn't occur that way. We're having more women having more problems with breastfeeding. So it's actually work that needs more support from every stakeholder. And most women, gender equality comes into play when the husbands are saying, I don't want my wife to breastfeed, it's getting stressful for her, and she has gone through the stress of pregnancy and childbirth. Breastfeeding is an extra stress, please spare her. But the woman says, I want to breastfeed, because it is an emotional thing for a mother. It's more than giving your child food. It's a bond. So more women want to breastfeed amidst the challenges. So, and sometimes the men are the ones that call the shots because they provide money for the household. They are left to be the ones to decide how is it spent. So, if the man says, I want to get a formula, and the woman says, I want to try another supplement, can I? And the man says no. And because one cannot afford it, she's left to have to resort to formula because the man has said that. So one of the ways we deal with this is we have a community. Early on, we built a community. We have a WhatsApp group of about 400 plus women where we teach them things they can use locally. We have one of our major products is a seed mix. It's a mix of all seeds that we use to fortify the breast milk, improve the quality and the quantity. So if they can't afford it, it's not a problem. If they go back home, sesame seed is one thing that can help. It's highly nutritious. It's also locally available. We also have local foods, local spices. We have local spices generally, local meals, pap. Yes, they may not do the work, but they would work. So if your husband is saying you cannot afford it, it's fine. You can still achieve your aim in the process. And it has gone a whole long way because, we have more moms saying, with the support of this community, I'll be able to exclusively breastfeed my child. And, it has become a celebration gala in the community when people say, when they design posters and say, yes, I successfully breastfed, it has become a thing of joy. Because even though we cannot afford it, we cannot afford what is available, or we cannot, we are limited by what our husbands are bringing to the table. Or even when the husbands say no, the women are empowered now to say, let's try this. I have the education. I have knowledge to know what is right or what I should do. And they do this, and it helps a whole long way in ensuring we can still meet we can still exclusive breastfeed our babies.
Thank you for that. That's interesting. It's something that I have thought about, but I never really understood how it gets done. Well done. That's wonderful. To you, Sheung, as your role as CEO, Mom in Chief, I think I'll call you that. As your role as Mom in Chief, I like the title, at Baby Grubs, which involves a unique perspective. Can you share how your business model aligns with a gender-sensitive approach, and what impact it has had in improving infant-child nutrition?
Thank you very much. So my title, the Mom in Chief, is because I work with moms. And so I'm the Mom in Chief. And to answer the question, let me give a bit of background as to how, the business started. And so when I had my son, I didn't know what to feed him. Honestly, it was ridiculous even for me that, okay, I know they take breast milk, but what else? And so afterwards, he wasn't taking all of the things I bought for him. And so I saw some information online, and I was doing a lot of puries and all of that, things from Baby Center, from NHS and all of that. But over time, I thought I was doing the right thing. But his foods were lacking in different micronutrients. And so my son developed rickets. And then I had to take him to Igbobi, actually. And when I was at Igbobi, I met some other women, from a community where I was. And in this community, I was already teaching them how to make baby food. And so it was embarrassing that, you yourself, you don't even know what you're doing, right? So, but the thing is, when I went there, I spoke with the nutritionist, the dietitian, and, I was made to understand that what he's eating still needs a lot of work. It needs a lot of nutrients and all of that. And so I took their recommendations. I reduced it to a formula because my background is computer science. So when it comes to the maths, it was easy. And so I replaced the foods with foods that were tastier, they were yummier, but had, all of the nutrients that you needed. And we combined them in a way that helped with maximum nutrient absorption. And so it was now easy for me to tell other mothers that all those things I told you, it was nonsense. This is the real thing now. And for me then, as well, when I was teaching them, they were saying, where can we buy it? Where can we buy it? And because there was now the community, I'm like, you sell, you can buy and resell. And over time, it became, in that community, because I was teaching them everything I was learning, the mothers were also now teaching other mothers what they were learning. And so we now decided, let's put structure to it. And so we now had mothers in different areas. And that really helped us even as a business, right, to spread really fast, across Nigeria. We were in 26 states, in the first 3 years that we started. And so we have a mother in, say, Jabi, who attends to all the women in Jabi. She sells to them, but not just selling, but she's also the nutrition advocate in that community. She's the breastfeeding expert in that community and all of that. So it also helped women in the sense that, before, I think it was 2 years after, a woman that was a secretary in a secondary school, she told me she quit her job to start Baby Grubs full time. I was like, who sent you? How would you go and quit your job? And so it now became that, so this thing is not just baby food, it's a movement for women. And so one of our biggest distributors, she quit her job in the bank, and this is what she does full time. And so for women, it was empowering them, to say that I can I don't have to do a 9 to 5, and I can still contribute not just to the family income, but also to the community. And on the side of infant nutrition, it also helps to be sure that we don't disseminate rubbish, right? We do the right thing, You start breastfeeding from 6 months. Nobody will come to you and it's less than 6 months and you will say, you sit them down and say, come, let me gist you. This is the right way to do it. This is what you should do. And so our children are thriving better. We're not, I'm sure for the women in my community, incidence of rickets, for example, is next to 0, right? And not just that, we also now focus on the different deficiencies that we've noticed. So we don't just do, even though our formulation is formulated to provide, all of these things, we also still add micronutrients into our products just to make it really rich. So the whole issue, when it comes to nutrition and gender, it's a conversation that should go hand in hand. Thank you.
Thank you for that. That's interesting. One of the things that really struck me was how you were able to, should I say, encourage women in the community to take it up and replicate in different parts of Nigeria. That's an interesting model, and I think if everyone can look at that model and be able to contextualize it, we'll get more actors supporting the nutritious food value chain. So we're going to Toyin now. As the CEO of August Secrets and the leading Women in Food Fellow, can you tell us your experience in driving sustainable nutrition initiative, especially with respect to reaching low-income consumers, knowing how we are right now in terms of our community in Nigeria, our economy rather in Nigeria, and how you think this can be scaled?
Okay, thank you very much for that. My name is Toyin Onigbanjo again, as just a form of emphasis. And at August Secrets, we make foods for children commercially available in supermarkets. If you go, you find them there, and mothers have come to appreciate the efforts that we put in. We are also big on education. As a matter of fact, we can't separate education from what we do at August Secrets, and that is actually the background of one of what we've been able to achieve. And it all also started with my son, Jaden, and our product is actually named after him, just as a form of memory. And there are so many children like him out there, they don't want to eat their food, and then, the mom is just trying to make an effort. And I think that really, if we look at all the similar stories on this panel, we'll realize it just goes to show the impact of women. Please, women, can we give a round of applause to yourself? The impact of women, the impact of mothers in terms of making the right decision for their children. And this is not to say that fathers are not involved as well, which we know that, these are, they are the pillars and the people supporting us, to achieve this. But then it's pretty much the same thing. He wasn't eating, and then I tried to find solution for him, and that solution is now, being scaled. And I think that I will just take it from the point of scalability. First, and then in line with also what we do at August Secrets, especially with regards to low-income families. So what we realized is that if we have a program called Saving 10K. The moment we already ascertained that, okay, there is a challenge, and then we provided an opportunity for the challenge to be solved, which is in our food products and in our education. We then took it a notch higher by setting up the Saving 10K. So the Saving 10K is our community program at August Secret. And what do we do at Saving 10K? We realize that if we go to the communities and you just go to give them food, you just go to you go there, and then you carry a bag of rice and oil and spices and go to give to these families, vulnerable families, of course, especially in low-income communities. They need it. We all do need it, actually. We need food. But then it's not just enough. Why don't we teach them how to make their own foods? So that was, the turnaround that we realized at August Secret. And with this, we've been able to reach more than 5,000 families at a go, because by the time we gather women together, at least a minimum of 500 to 1,000 women and children are being engaged. So what we do is that we have a quarterly program where when we go, we started then, I remember the very first time we started, when we got to the traditional head in the community, like, okay, so how many bags of rice do you people want to bring for us? And how many Maggi do you want to bring? We just told them that, Oga, just relax. We're here to teach our women, because we know that there is no amount of bags of food that we bring that is really going to change their lives. Instead, why don't we do something that has a more sustainable approach? So we say, Mama Pikin, we are here for Mama Pikin. All the men, they will now stand. I mean, this is not what's it called, a slight on the men, but you know, these young guys will now say, oh, where's our own food? Where's our own? Of course, the very first time we did it, we had jollof rice, we had food. And then they're like, oh, yeah, give me my own food. And we said, this food is targeted at only nursing mothers and mothers of young children, and also pregnant mothers. And then they're like, me too, I'm pregnant now, you know, the fun and all that. But then we ensured that it was not just about the food. It was not just about, you know, handing them our products or handing them, making food for them. We want to teach our women on how these children will stop having these diseases. We want to teach our women on how these children will stop being like this, how a pregnant woman would stop losing weight. Okay, so, and those were, we worked with medical doctors, nurses, and that's what we do pretty much with nutritionists, and then they start teaching them. Of course, after the teaching, we know that food will follow, but we want to ensure that these lessons are able to transcend from one woman to another. So we engage even the community nurses as well. So when the community nurse is speaking to you, you would know that it's really serious. It's not just about me coming to you to say, oh, come and buy my product or do it this way. So we ensure that it's an end-to-end thing, from breastfeeding to wash to hygiene, everything all encompassing. And that's how, you know, it's with the Saving 10K pretty much that we're able to do. And in terms of scaling, I believe that there's still a lot to be done. I really can't sit here to beat my chest to say that we've really scaled it. I believe, I think I'm going to take a leaf from, you know, what Kemi has said before. And you know, as a matter of fact, Kemi and I have spoken about it. So looking at collaboration and saying, how can we, you know, scale, you know, ideas like this? That for me is a rhetorical question. You know, I really can't say, oh, we've scaled it. We've reached 5,000 families, but then is that enough? The answer is no. So I would take our partnership as one of the biggest lessons, and we're definitely going to continue our discussion from where we stopped to see how we can scale that. Thank you.
Thank you. Partnership for growth, for scalability. Wonderful. I'm happy that we are all echoing the same thing in different ways. And for me, it looks like there's an opportunity for us to have a women-led association for nutritious food. Or what do we think? If we could even just start with the women on this panel who are doing amazing things in their community, think about what more we can do when we go across the 36 states of the Federation. Based on this, and this is to everyone now, all the panelists, considering the unique challenges and opportunities in the nutrition sector, how do you envision a women-led association for nutritious food in Nigeria making meaningful impact? Who would like to take that? All right.
Thank you very much for that question. I think it's pretty much a common sense solution to scaling. They say, first of all, from the nutrition standpoint, it takes a village to raise a child, right? So we really must come together as a village, as a community. And I remember recently, Madam Baku and myself were at event in Cotonou, and we had bankers come in and speak to us about the opportunity for funding in the agric sector. And after one of the sessions, I engaged one of them, and she was like, what kind of money are you looking for? I told her, and she was like, that's too small. That's too small. Can you aggregate yourselves and then have a more meaningful conversation with us? So, and also sometimes, I go to the retail spaces, and we're not that strong in the retail spaces yet. We've done more programming. And I'm proud when I see Jaden on shelf. But I also see a lot more of these imported products. I don't see us strongly represented. And then I did a check, and I realized that the industry we're talking about is about $500 million. Yeah. I mean, how much of that can we even say we have in our books? So, I think that it's just common sense that we co-compete, we collaborate to compete, create a bigger pie, look for how we can give value for value, and by the time that value goes round and is coming back, it's multiplied. And then we can have a stronger fund. We can even engage government better. We can hold Madam Bako together. Only me. Only me cannot hold her. But if we hold her together, we have a firmer grip and say, you know what, we need policies that work for us. We need to have access to your research institutes as organizations so we can batch test. And then we can scale even in terms of quality. Because batch testing, whether you like it or not, is expensive. And you know, for us to be able to do that consistently and be able to compete globally, we need some kind of support. And this is possible across plenty pockets that government has. And that's what enablement is possible for us when we come together.
Thank you for that. Thank you. So, do you want to add?
Yeah, let me add to it.
For fear of being held.
You see, it's really interesting to find out that quite a lot is being done, at different levels by women, by great women, to enhance nutrition. So from the policy angle, we have quite put in place some resolutions. We have the breastfeeding initiative guideline and it talks about us establishing breastfeeding support groups to encourage women to breastfeed and also to encourage women on how to translate from the 6 months exclusive breastfeeding into complementary. Because most times you see a child is well, looking very well, but after 6 months of exclusive breastfeeding, 0 water, the child just drops. And it's because the woman does not have adequate knowledge on how to translate. So we are also encouraging that small scales enterprises like the 10K and the Mama, we're looking at developing guidelines to standardize so that what you are doing in your own little sphere, other people can emulate. And then other can come and even do study tour to find out how are you doing, what are your challenges, what were the mistakes that you made so that they don't do the same thing. So for us, looking at from the policy angle, we are looking at bringing everyone onto a table to discuss, to find out what are you doing, what are the challenges, what are our priorities. We'll map, because we know that the private sector is doing quite a lot in this area. So who is doing what? So we'll map ourselves. Then together we agree what are the priority issues that we should focus on, because there is a need for us to have a drastic change in the current unacceptable nutritional status in our country. Thank you.
Thank you, Ma. So while you're still holding the mic, I'm still coming back to you, please. I'm happy that you've mentioned standardization and quality a number of times. I think it's really important. For a policy perspective, how can government and major agencies, including regulatory bodies like NAFTEC, collaborate to support the establishment of this women-led association, as well as other smaller than individual businesses? So, for example, under the Strengthening Nutrition in Priority Staples project, which I manage the business support angle, I work with businesses like this that are trying to solve some of these problems. And one of the biggest challenges that they have is getting their registration sorted, registrations with NAFDAC, because of the cost implication, and also because of, from their end, again, if you're working in communities, you would understand the peculiarities of this community, understanding sometimes how the regulations are and all of that. What can we do to support them? I understand that it's on the onus on the business to do this, but is there a way we can give soft landing to these women-led organizations, knowing the importance of these products that they are bringing to the table?
Thank you very much, Mercy. We have a platform through which we interact with both governments, other agencies like NAFDAC, Standard Organization of Nigeria. The platform is called the National Nutrition Technical Working Group that meets every quarter. So issues are brought to the fore and discussed. And any organization like the small business scale organization that are working in the different aspects of nutrition along the life course are requested to register with the ministry. Because we need to have a database of who is doing what. And that registration is done by the Department of Planning, Research and Statistics. So once we have that information, under the National Nutrition Technical Working Group, we have different subcommittees. There is a subcommittee that handles this small scale. And then at the state level, because we don't expect everybody to be coming to the national. Yeah. So at the state level, we also have the state structure. And well, in some states, they are just setting up. Okay. But at least most states have something. It may not be very strong, but they have something. So we encourage that you relate with the state chapter, and then whatever thing that you're doing, there is standardization. You look at it, you follow the laid down standardization, because we have to ensure what you're doing, is it safe? What is the quality? We do not want to give our children food that will affect their health. So once everything is done, and then NAFDAC has offices at the states. They will inspect. And yes, there are criteria, but the criteria are not set, are not cast in stone. Yeah. So when they come for inspection, based on the understanding that we have had at the National Nutrition Technical Working Group, they are there to correct. If they see anything that the small scale is doing that is wrong, they are to correct you and make sure that you do the right thing that will not affect the safety. So these are some ways that the government is supporting the establishment of a small-scale women institutions to encourage and promote healthy eating within the country. Thank you.
Thank you, Ma. I think that's very educating, because I don't think a lot of people knew about that. That support is very vital, and I know I would be reaching out to you personally on that, because we have a lot of people that need that. Okay, so now to questions, Q&A. It's been an interactive couple of minutes, and I think we've all gotten something from this panel. Do we have any question to ask our panelists? Okay, so we have one question. Oh, we have another one. Ose, please. Okay.
Do I need to stand? Okay.
Please introduce yourself first.
Okay, good morning, everyone. My name is Nisi. I'm the project coordinator for microfinance activities at AFOS Foundation. So AFOS Foundation is an NGO that offers capacity building and access to finance for smallholder farmers and micro entrepreneurs. Thank you very much, Mercy, for coordinating such an interactive discussion. The quality of knowledge that has been shared this morning, I appreciate taking a lot. So I just wanted to comment on when Doctor was talking about having the male buy-in when it comes to the breastfeeding tenure and all of that. So I just wanted to comment to say we mustn't necessarily do this isolating the male, because discussions should be around including them and bringing them along to whatever we're doing, because we need that support. Yeah. And sometimes it's not necessarily from the fact that the woman does not have the capacity to do it. Sometimes she actually has the capacity to do it, but she needs the support of the husband to carry her along. And I'm excited to see that when we now have forums or we have discussions that we're discussing gender-related matters, the male are also interested and they want to be part of it. So it's something I'm excited about. Then when Kemi was also talking about scaling up, and what easily came to mind was consistency. Because when we scale up, we would have that consistency. I've used Jaden's Naughty Meal, I think one of your products. Yeah, I have. So when I had my daughter 1 year ago, we used it. It was from ShopRite. And then she really loved it because she's a picky eater. And then we went back like after 2 weeks and it was nowhere to be found on the shelf. So we had to now look for other alternatives. So for some people, when you're not consistent in the market, it's easy to change the product. So thank you very much. Thank you everyone.
Feedback.
Thank you for that. That's great feedback. I think we have one question. Shesi, please could you help with the mic?
Good morning, everyone. My
Good
name
morning.
is Bernard. I work with Nigeria Health Watch. So I was still going to speak towards inclusion for men because while the conversations have been very...
Your mic, please.
Oh, sorry. My name is Bernard. I work with Nigeria Health Watch. So I was still going to speak on inclusion for men because while the conversations have been very insightful, I feel like we have single fathers out there who are not privy to these conversations. What do they know about nutrition for children? So I feel like we're here for gender inclusion. It would have been very nice to see men, even in the panel, because who knows, we might get insights from them. Thank you.
All right, that's noted. Thank you for bringing that to the fore. That's an interesting thing.
Okay, good morning, everyone. My name is Eunice Kodak. I work with Federal Ministry of Health and Social Welfare. My question is to Doctor, the first speaker here. When you were talking, I love the fact that your product was like an encouragement to mothers who are actually breastfeeding. But there's one very key thing I noticed about breastfeeding mothers. One key reasons why most of them don't actually exclusively breastfeed for the first 6 months. And that is a drop in the weight of their child. Because most mothers from 0 to 3 months will all discover that I am a breastfeeding mother too, so I'm also talking out of an experience. So from 0 to 3 months, you will notice that there's always a sharp increase in their weight for exclusively breastfed mothers. Then from 4 months to 6 months, and mostly from 4 months to 6 months, the weight of the babies will start dropping. And that is like a very huge discouragement to most mothers. In fact, I have a lot of people who I support. Once they get to 4 months, they will start complaining that, my child is losing weight though. I don't think I can continue this. So how do we in this house encourage mothers to do certain things that will, both in educating them? Because one reasons I know is that at that stage, the child, they would have started moving around, turning, expending energy, unlike when they were below 3 months, that they just suck and sleep and cry. When they start moving around, they're expending their energy. So how do we encourage mothers to ensure that they complete that 6 months exclusive breastfeeding period? Thank you.
Yes, but we need to wrap up.
Okay, so let me quickly reply to that. So one thing, like you said, one of the reasons is, so breast milk, let me start from breast milk, there's quality breast milk. There's breast milk and there's breast milk. All breast milk are not the same. So one thing is, our product is made with seeds, which has a high fat content. So one thing we usually encourage them to do is, if you use it, it helps to improve the quality. That's why we not don't increase the quantity. We are particular about the quality, because it's quality, especially with these, typical breastfed babies have this chubby look, and which is one thing one mother is looking towards. So increasing, because most times at that 4 months, like you said, they are eating more. So breast milk cannot even fill. Usually, you need to breastfeed more. And that time, most mothers do not have that time again. Maybe from 0 to 3, you are taking maybe 60 meals 3 times, maybe 10 times a day. Now you are taking 150 meals 4 times a day. So the quantity is more. But if you supplement the breast milk, so it's high in fats, it helps to manage the situation. And also for the mothers, it means they are doing more work. They need to eat more. And that's one breastfeeders do not. They are trying to balance between adding weight as a breastfeeding mom and feeding your child right. So they don't want to add more weight. You still want to maintain the figure 8 shape, but you also want to breastfeed your baby. So one thing we usually encourage them to do is, if you eat healthily, you're eating more raw veggies, more fibers in your meal, it will help you. You can balance. You are not adding weight. Your baby is also eating more, because when after a typical breastfeeding session, you know something that left you. Your eyes roll and you want to pick up the next thing. So they say for most breastfeeding mothers to snack unhealthily, which is one factor that aids weight gain. So, but when they manage their nutrition, so it also goes into education and knowledge. Once you are getting to that stage, you are not eating just anything. You are very particular about your meals, so that you are giving your child the best. You are also doing the best for yourself as a mom, so you can continue breastfeeding till the 6 months.
Thank you for that. That's interesting for even women that have not gotten to that stage of life yet, but that's something to note. Okay, so we've been talking about Women-Led Association for Nutritious Food Business. Show of hands, how many of us would like to join this network or this association? All right, so we're going to be sharing a commitment form now. If you would like to join it, please fill the form. If you would also like to learn more about SPN, what we do around supporting nutritious businesses, associations to develop the safer nutritious food, whether it's in capacity building, whether it's access to finance, I would encourage you to join, to also write your details as well so that we can contact you. There's a lot of opportunities that we are here to support you with. I'm happy that Kemi has spoken about this in terms of accessing finance. It's something that we're really passionate about, and we can actually leverage this network to do that. So the forms will go around. Shesi, please share that. Please feel that we'll be here to answer any questions. Thank you very much for your time, for listening to this conversation. Thank you for the feedback. I really appreciate it. I think it's really useful, and we'll take learnings for next time. So thank you very much, everybody. Have a wonderful day.